5 o'clock, and I will call the meeting of the County Board St. Croix Supervisors to order at this time. And for our invocation today, Tim Sackett will conduct it. Everybody please stand.
Am I unmuted now? Hello?
Yep, go ahead,
okay.
Tim.
So I got the thumbs up. Thank you. So here we are again. We thought we were making progress, but I think we were making slow progress to be able to get everybody together. Looking forward to the time when we can do that openly and comfortably, because I miss the handshakes and I miss the contact and all that, and I'm sure everybody feels the same. I've been thinking about where we're at today, and this isn't the first real major tragedy our country's gone through. This isn't the first time our country's had to do things like mandate restrictions on people, but it seems like it is because we have such a short attention span and sometimes a lack of knowledge of the history of our country and even our world. But here we are kind of making our own history so that we can set the tone or set the pace for future generations, I hope. And so I thought that as everybody's trying to use the word freedom correctly or properly in their own terms, I'm amazed at some of the founding documents that our freedom as citizens in this country, our freedoms are not granted by the government. They believe that they were granted by God through our faith, but the government is protecting that faith and therefore protecting our freedoms because of our faith. Jesus often talked about how we can know the truth and the truth can set us free. Those are the kind of things that I think people of faith understand, that the true nature of our freedom and the expression of it is something wonderful. It's something we value, and it's people in government, even whether it's local like you guys at the county board. We thank you on behalf of the churches and the faiths in our country to be able to have our expression and worship, and it's protected and it's guaranteed. And we're thankful for that. We always think about that. With that, let's pray. Our great God in heaven, you have given us more hope than we could ever generate among ourselves. You have given us more vision, more reasons to believe, and it's important to us, and we value that, and we thank you for it. I thank you for the people in this community, this county, and especially the people on the leadership on this day when they gather as leaders of our communities, leaders of our county. We ask for your blessing. We thank you for protection and safety. We thank you for gathering together remotely and in person to doing the best that we can in the circumstances as we understand them. So we ask for a great day, a great meeting. Thank you for the pleasant weather. Thank you for a turning of the winter weather. Looking forward to spring. During this time of Lent season, looking forward to a few weeks from now when Lent will culminate in the celebration of your resurrection. It's in Jesus' name we pray. Amen. Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please, Cindy.
Ed Schockner,
Present.
Sean Anderson,
Present.
Bob Long,
Present.
Kathy Leaf, Present.
Kara Cook is absent. Tim Hall. He's there, okay. Paul Burning,
Present.
Rick Otino,
Present.
Bob Fiedler, Dave Osnes.
I'm not getting
Scott?
any audio remotely.
Yes, we got you. Scott Coner,
Present.
Dan Hansen. Okay, okay. Okay. Scotty Yard,
Present.
Greg Telejohn,
Present.
Dave Peterson,
Here.
Paulette Anderson,
Present.
Judy Achterhoff,
Here.
Shelley Tomschick,
Present.
Bill Peavy.
Here.
One absent.
Okay, for public comment this evening, I will allow 20 minutes total time and 2 minutes per individual. First card I have is from Mark Carlson. Please step to the podium.
I sent an email out a couple days ago, and of course it was too early for anybody to reply. I sent it to the board members, but I just have some questions about COVID, our response to it, and how things are going. It's been almost a year since 2 weeks to flatten the curve. Could we get, or could you provide any and all data obtained through contact tracing? If it's out there, I can't find it, but I understand we've been doing contact tracing, and it'd be interesting to see the information from that. How long does it take for a mask mandate and social distance mandate to be effective in lowering COVID cases? How did St. Croix County manage to lower the spread of COVID since we didn't have a local mandate? Would have a local mandate to wear masks that was voted on, if that would have passed, would have it made any difference? Do the 9 board members that supported having a local mandate still believe we should? And do the 10 who voted against it wish now they would have voted for it? That's kind of a rhetorical question. It'd be interesting to know, though. What is the end goal for our battles against COVID in St. Croix County? What would be the hard data points? When I talk to people, people are really confused about how long should this go on? If it's time to end it, or is it wise to continue? How many people died overall in St. Croix County in 2019? And how many in 2020? It would give us a good idea of what COVID has done to know those two numbers. And then last of all, I keep hearing the slogan, we're all in this together. And I'd like to think we all are. However, it seems like St. Croix County Board, and maybe government in general, is expanding and hiring more people. What I would like to see is the board asking department heads to come up with a plan to lower the hiring or to cut their budgets. And that would be it. Thank you. And by the way, I was supposed to say my name. I'm Mark Carlson, and I live in Pleasant Valley. Thank you, sir.
Jen Flanders.
Hi, Jen Flanders. I just wanted to say I'd like to start off saying that I received a copy of the health newsletter, and I appreciate the effort that was made to include things that could actually boost a person's immunity, like vitamin C, vitamin D, and a healthy diet. It's a shame that there was less space for that and more for a vaccine, and that it was at the end of the newsletter versus the 2 pages at the beginning that were strictly about vaccines. Our health is far more dependent on good nutrition and natural immune boosters such as vitamins and minerals than on a vaccine that's made with chemicals or metals that have only been proven or are proving to cause us to react in negative ways such as autoimmune deficiencies, ITP, Bell's palsy, and even death. The term vaccine actually means that our body is creating antibodies toward an invading disease. That's not what the COVID vaccine does. But my other main concern is election integrity. And I'd like to quote this quote that I found today. The Supreme Court's failure to date to address the massive election fraud and multiple constitutional violations that wrought a coup of the presidency of the greatest country in the world history completes the implosion of each of our three branches of government into the rubble of a sinkhole of corruption. It is an absolute tragedy for the rule of law, the future of what was a republic, and all freedom-loving people around the world. And I'd like to ask this board, what have you done to ensure the integrity of our November election and our future elections? What steps have you taken to ensure that we, the people, are able to vote in the representatives that we see fit to represent us? What have you done to encourage those above you in the state and in the federal House of Representatives or the Senate to let them know that you are concerned about the integrity of our elections? Thank you.
Debbie Kraft.
Good evening. My name is Debbie Kraft, and I live in Roberts, Wisconsin. I want to thank you and commend you all for the addition to this newsletter that I received. Last time I was here, or perhaps it was at HHS, I asked to have information included about nutrition so that we can empower residents to take control over their own health care by any means that they have available to them. I saw that and I appreciate it. It probably does not escape you that some of the things that we've been talking about, like cycle counts, have suddenly been a topic of conversation for WHO, and now that that's blessed by them, I hope that you will consider some of the things that we've said with regard to that. There are some inaccuracies in this report, however, and I'd like to make you aware and ask you to please give consideration to informing the public. Couple of things. First of all, you tell us to go to the Mayo Clinic site to get more information. Mayo Clinic site says there are no adverse effects. Some may be short-term moderate that will resolve without complication or injury. According to the CDC, between December 14th and February 18th, 19,907 adverse effects were submitted to the VAERS system. 1,095 deaths have occurred. 3,767 serious injuries have occurred. 1/3 of the deaths occur within 48 hours. There are 160 reports of adverse reactions affecting pregnancy, 47 miscarriages or preterm births. This is not accurate. Let's please give accurate information to people so they can make informed decisions. Thank you so much.
Charlene Stoddard.
Hi, my name is Sarah Bachland. I live in St. Croix County. I just wanted to address the board tonight. I routinely comment on St. Croix County's posts and with no responses except for people who, anyhow, I just wanted to address a few things. I'm just asking that you guys provide more content for the people regarding vaccine injury information. It is out there, and they need to be able to hear that from you guys. What about informed consent? You should be providing all information to citizens. What about the Hippocratic Oath to do no harm? Even if just one person is harmed from the vaccine, you have violated the oath. What is your goal of pushing this vaccine? To reach herd immunity? The vaccines don't even claim to be able to produce herd immunity. Just wondering if you guys even know that. People are getting this vaccine and then getting COVID. I just don't understand the push for this. I'm asking that you guys provide more information on the website, please, to the citizens, more rounded information, so they can make proper decisions on whether to take the vaccine or not. So, thank you.
Charlene Stoddard. Charlene Stoddard.
Hi, my name is Charlene Stoddard. I live in Roberts, Wisconsin. There's nothing specific I wanted to address. I just wanted to say a few years ago, my family and I took a much more homeopathic approach to our healthcare, and the results we've had are phenomenal. There are 3 things available on Amazon Prime that I'm just offering to you guys, offering to the community to maybe check into. One is called Escape Fire, the fight to rescue American healthcare. It talks about how the healthcare system we have is designed to profit on disease rather than on health. Another is called The Healing Field. It's exploring energy and consciousness. It talks about energy medicine, DNA, genetics, acupuncture, things like that. And then Heal, it's a documentary. That's also, all these are available on Amazon Prime. That one talks about the human body can heal itself from any disease, literally any disease. I highly encourage you to watch any or all of them and just think about the other things we can do to keep ourselves healthy and not be relying on pharmaceutical medications and vaccines, which are not actually vaccines. Vaccines will never produce a true herd immunity, ever. You should do some research if you don't believe that. Thank you. Bye, guys.
Anyone else who has filled out a slip that requested comment? Okay, I'm going to close public comment at this time. We'll proceed on with the business items. And the first item would be the consent agenda. Do I have a motion to bring that forward? Supervisor Osnes, second by Supervisor Burning. Discussion? Seeing none, we'll vote. All those in favor signify by saying aye. Aye.
Aye.
Opposed? Carries. Thank you. Okay, the presentations and recognitions. I guess the next item would be COVID-19 update from Public Health. Did you want to introduce that, Ken? Or is Bob going to take it?
Yep. I believe Kelly Ingen and Ellie Clausen are online to provide the presentation tonight, and sharing is available, so if you need to share something from your screen.
Thank you, Board of Supervisors. I think Ellie will bring up the presentation.
Thanks, Kelly. Let me go ahead and bring that up. Okay. Again, as Ken said, welcome to us. My name is Ellie Clausen, and I'm the epidemiologist for St. Croix County. I'm here to provide you a brief background and status update on COVID-19 in St. Croix County. Currently, to date, there have been 7,961 COVID infections within St. Croix County. Currently, to date, of this moment, we have 8 hospitalizations, and we have had 47 deaths Unfortunately, I cannot provide the information in front of me for those in 2019 versus 2020, but I can definitely provide that information. What does this mean in terms of where we are looking at a metric? One metric we have used to determine our status with COVID-19 is the Harvard metrics on the path to zero. This looks at a case incidence, which is our total number of daily infections by our population size. So we're currently sitting at a 14, which means we still are at a level of accelerated spread. In looking at kind of the range of flattening the curve, our new cases per day, yesterday we had 15 new infections reported to public health. What that means in terms of a 7-day average, which we always look at to kind of adjust for the daily fluctuations, we're seeing about 12 new infections a day. What that means for us is where we are now is about where we were at around the 18th, the 15th to the 18th of September, where you can see on the curve. So we have definitely risen up to our grand spike and we are on our way down, which is nice. We haven't yet come down to a level where we have moved out of that orange kind of into a yellow level, but we are on the right path in St. Croix County. Now, where are these infections that are happening in St. Croix County? So we have 7, I want to back up a second and just say, of all of our cases that we interviewed, 72% of them were able to identify the source of their infection. This was all self-identified by the positive individual. 40% of the individuals identified the community as the source of the infection, followed closely by 30% being a household contact, or 21% could identify an actual individual with whom they had close contact was positive and spread the infection. In smaller amounts, we've seen infection in long-term care, in the healthcare situation, in the schools. We've had outbreaks, and then very few associated with travel at this point within the St. Croix County population. Of those still testing positive, we still are seeing 19% of individuals testing positive. That is a 7-day average. We've talked previously about the percent positive being a metric in looking at the amount of disease in a community and how well we're doing at capturing it. And so what we'd like to see is actually a percent positive below 5. We were headed down, and then as you can see on the graph in the bottom right-hand corner, we have recently started to creep back up again. So what we want is just like our cases per day, we want that percent positive to continue decreasing until it drops below 5. So that's still a metric we want to work on. That it is now only in the past within the month that it's risen, and so there is still time to tell. That will bring that back down, but that is the goal, that percent positive drops down. Okay. And then finally, in COVID-19 vaccinations, there have been over 18,000 vaccines administered to St. Croix County residents. What that means is of that 18,000, over 12,000 have received a first dose. And then of those 12,000 that have received a first dose, almost 7,000 have completed the series. On the graph you're actually looking at vaccines administered by St. Croix County Public Health. We are doing vaccine clinics, and Kelly will speak more to that. What you can see here is just the doses that we've been privileged to distribute, noting that if there was a dose, maybe we gave a second dose, but we had under 10 second doses to be able to give, then those small numbers would not appear on this graph. That sums up my summary of COVID in St. Croix County and its current status, and I'll pass it on to Kelly.
Does anyone have questions? I'm just going to slightly differ. Does anyone have questions for Ellie related? I'm going to get into vaccine planning and eligibility because I know there are many questions related to how do I get my vaccine, or how can I help other people in my life get vaccine? But I'd like if there's questions for Ellie related to that.
Apparently not. Kathy Leaf, go ahead.
Sorry, I just had one real quick question because everyone seems to be, we're focusing on vaccines because we're excited we have the opportunity to vaccinate. Can you tell me about what's happening with testing and the importance of still doing that to help identify the presence of disease?
You bet. Actually, I heard Dr. Ryan Westergaard, who is our chief medical epidemiologist for the state of Wisconsin. You may have heard his name before. He said on a call yesterday, in order to really get back to a sense of normalcy and thinking about walking back some of these COVID precautions, social distancing, masking, really being attentive to your health. He said we need to look at 3 different things. And one of them included, I'll take them in order, getting people vaccinated is one major key point we can do. The other thing is making sure people are symptomatic, are getting tested. And the other third piece of that is similar to the second, which is surveillance testing. And I know overall, if Ellie were to go back a few slides and look at our testing in St. Croix County, we definitely have seen testing drop off. I'm not sure that we have hit yeah, thanks, Ellie. So obviously when we knew there was a lot of disease in our county back in mid-November, we were testing a ton, right? There were people getting symptomatic and sick and testing. I think surveillance testing, per Dr. Westergaard and other medical professionals, say we have to have a pulse on, is there asymptomatic spread? Now that we've introduced a vaccine to the population, is that impacting how sick people are potentially getting related to either being vaccinated or not being vaccinated? So I don't know, Ellie, if you have thoughts on testing and kind of what it looks like in our county, but I think surveillance testing really right now in St. Croix County is only happening in our long-term care facilities, and that is because of a mandate by the Center for Medicaid. Once a long-term care facility has identified a positive test or a positive case in their facility, they go through a real rigorous testing of all staff and all residents. And that is really the only surveillance testing we are doing. You might know individuals who are getting tested on a weekly basis, which is great, but that's probably a pretty small proportion of our general population that are that attentive to getting tested and kind of checking themselves for COVID-19. Sorry, Ellie, I went long there.
No, and all great points. The only thing I would want to, a couple things is the CDC has defined and it's kind of a level of testing per population in order for it to be at a standard for us to feel confident that we are doing sufficient testing to find disease and trace disease and stop disease from spreading. And unfortunately, we should test at about 130 to 135 tests per day. And right now we're sitting at an average of 58 tests per day. So we are falling pretty short on testing. Testing is one of the best methods to find the disease, to root it out, and to stop its spread. Because once an individual is tested positive, we are then able to do our jobs and give them the advice and the guidance to stay home and how to prevent them from spreading that disease to others. So DHS, CDC all recommend that if you are identified as a close contact, or if you are symptomatic, or you believe that you've had contact, to go get tested. We understand that there is fatigue with people having to stay home, but if we are going to kind of pull in a rein on the active disease in our community, one of the best ways is to test and find it. That a lot of countries have shown awesome examples of lifting restrictions because of their very intensive testing programs.
And just one last note related to the continuing of testing. We still are meeting with hospital CEOs twice weekly. So we are having these conversations about the importance of continued testing. Obviously now our lane is focused a little more on vaccines, but these are all they're talking about with all the healthcare providers in St. Croix County and actually Polk and Pierce County as well. All right, Ellie, you get me to those other slides.
Supervisor Achterhoff, I believe you may have had a question.
I had a different one, but I'll ask later. But this one is, but wouldn't the testing go down with the number of cases going down? I assume people only get tested if they think they have the virus. So does that mean a lot of people just aren't getting tested, or does it mean a lot of people think that they haven't been exposed? And what's the difference?
I think there are multiple things at play in order for our testing numbers to go down. I think testing positive numbers and testing numbers do go down, obviously, like you said, with less amount of cases, then obviously we aren't having as much spread. I do think there also is the play of testing is going down outside of the amount of disease because there is a sense of the fatigue with quarantine and the fatigue with identifying close contacts. And we found that in our outreach with positive cases and the refusal to identify people who they've been with, because it is a burden on life to restrict yourself home in order to not spread the disease. And it does interfere with daily activities.
Okay.
Okay, we'll move to talking about vaccine. I think the state came up with kind of a tagline here related to eligibility doesn't equal availability. I may have shared that at our last meeting. All the meetings seem to run together. We are working very diligently in St. Croix County, not as only St. Croix County Public Health, but as I mentioned, with our healthcare providers who are vaccine providers. So we had an enrollment process. I know I've spoke to the board about that. Right now, as of yesterday, March 1st, many new groups became eligible to receive vaccine. And I think the public's perception about that March 1st date is misguided, as we still are not getting a ton of vaccines into the state of Wisconsin. And the allocations per county and per enrolled vaccinator are really dependent on a formula that the state DHS has come up with. So we are not seeing our total allocations met when we request vaccines every 2 weeks. It was weekly there for the first few weeks. And I mean, there was a week where we received 0 allocation of, I believe it was 400 doses that week we requested. So vaccine in general, the actual product is what I see as one of the biggest barriers. Next slide, Ellie. Whoa, I put a lot on this slide. So I did want to highlight that the state of Wisconsin did identify a working written plan that came out to local health departments probably a week and a half or so ago. Obviously, we have 2 goals: administer the vaccine quickly and equitably across multiple populations to achieve 80% immunity or 80% of our Wisconsin residents being vaccinated. Right now, I think DHS's statistic looks like we're just above, I think around 10% of our population. Ellie can correct me if that is wrong. We have to base a lot of this vaccine coordination on a lot of assumptions. So I've highlighted a few of these things that come straight from the state's plan, so you guys can take a look at them. I'm not going to read them to you aloud. Next slide, Ellie. So here's some more of the plan assumptions related to the state plan. On the left-hand side, the right-hand side of your screen really looks and focuses on eligible populations, who is currently eligible and who will be the next eligible. So this specific infographic or graphic was taken prior to yesterday, the March 1st deadline. And we are currently now open. I don't know if my cursor works so you can see my cursor, but these next eligible populations are all populations that currently hypothetically, if availability of vaccine was plentiful, we could be vaccinating all of these populations right now. The unfortunate thing is you have to remember my first statements about we just don't have enough product right now to get vaccine to all of those who want it. Next slide, Ellie. So some of the things that we're doing locally, DHS does hold vaccine webinars 2 times per week. We continue to meet twice weekly with all CEOs and I would say high leadership within Pierce, Polk, and St. Croix counties. We check in Tuesdays and Fridays to say, Tuesday's more of recapping what happened the previous week and then sharing with each other how many vaccines we've requested for upcoming weeks. And then Fridays, we kind of say, did we get that amount of vaccine that we requested earlier in the week? A couple good reasons why those meetings have been really effective. We have been able to pair our school districts with healthcare providers in St. Croix County. Our healthcare providers stood up and said, yes, we will pair off school districts and we will be responsible for school districts and get them vaccinated as soon as vaccine becomes available. There's other examples I have of sharing vaccines. In fact, I drove vaccine because we got our shipment for next week in today, or I'm sorry, for this week in today. We were able to take a few of our doses so another healthcare provider wouldn't have to cancel people's appointments. I know some healthcare providers have had to cancel appointments. Sometimes it's related to weather. We had a interesting weather situation in the south a couple of weeks back, and that really did impact vaccine getting to Wisconsin and getting distributed out. But we have had those provider meetings have proved to be a good source of collaboration so we can talk through problems and troubleshoot things like that. For St. Croix County Public Health, we are not making vaccine appointments until we have vaccine in our hands. I just think it would be an overwhelming task for us to pre-book appointments and then have to call 200 to 500 people on our list and tell them, sorry, we don't have vaccine. So that is a decision we've made at St. Croix County Public Health. We do not book appointments until we have vaccine in hand. We meet logistically as an HHS team on Monday mornings to kind of talk about the needs of the week, what vaccine clinics are planned, and any unmet needs or gaps that we foresee for the week. And local planning for rollout of vaccine, prioritization group. We started this with our healthcare systems late last week about really deciding as a conglomeration Will you start vaccinating? Are we going to try to be consistent to stay vaccinating the same types of priority groups? We have a lot of residents in St. Croix County that fall into a 65 and older category. I think it's like 14,000 some. When we are only getting 200 to 500 vaccines roughly, and that's pretty straight across the board as providers, and it's more on the 200 to 300 vaccines per week. It's going to take time to get through thousands and thousands of people. Next slide. Okay, so this one cut off. You have seen this graphic before. I believe it is out on our website. Really 1B looks at all of the different open categories now that are available to be vaccinated. These are categorized in a priority order. So really our big focus in coming weeks are our school districts as well as childcare providers. Fun fact, if you didn't know, we have 69 different childcare providers in St. Croix County, and that does not mean individuals. That means 69 facilities that are licensed by the state. We know we do have some big centers that employ a lot of people. I asked one of our staff today, could you ballpark? What do you think? How many staff are we talking here in this childcare arena? And it's really, she was going to look for data to see if we could get a better handle on that. We do have all that contact information. I think the last thing I will add is one of the nice things about pairing school districts with clinics or hospitals gives public health the opportunity to really focus on our childcare providers, which we know we have a lot of. Okay, is that the last slide? Perfect. So that's really the end of the vaccine presentation for the County Board of Supervisors. If there are questions, we can do our best to answer.
I have one, Kelly. With the rollout of the third vaccine available, will we also have access to that? Does the state decide that? And if it becomes available, will it be available for our residents if they'd like, maybe a bird in the hand, horse two in the bush to get that J&J?
Yeah, so you bring up a couple really good points. So one awesome thing that happened this week is over the weekend, the emergency use authorization of the J&J Johansson vaccine was approved. So we do have that vaccine coming into Wisconsin. I have not seen the number per DHS. I've seen it via local news media, and it says around 45,000 doses. That is not a confirmation from Wisconsin State Department of Health. I haven't seen how many we are getting as a state. We know there's other vaccines that are close to reaching emergency use authorization. AstraZeneca has a vaccine. So we do know we will be getting more vaccine into our state. We just don't know what that allocation looks like locally. As far as general population goes, when we look at, we can send that link out to the state's plan. I think the state has very lofty goals of reaching our general population by like the end of summer into fall. I really hope that does happen. But when you just do the math, and I'm not a huge math person, but when you just look at the math at the kind of vaccine numbers that are flowing into St. Croix County and the demand that we are seeing, we have that form out on our county website. I know we have around 14,000 people who have entered their information on that form. Now, some of those are duplicates and triplicates, and it's really another plea to only please fill out that form one time. I understand people really want the vaccine, but that was our assurance piece to say, once you fill out that form, we won't lose you. We will find, we have you. We will communicate with you when it is your time to be vaccinated. Was that an okay answer? I hope I answered your question.
More than adequate, thank you. Supervisor Hall, did you have a question?
I'm sorry, real quickly. So we've heard concerns about the vaccinations maybe having an effect. Do we have any idea of what the rate of reactions are, say, to something that we're more used to, like the flu shots or anything like that?
So what I can say is, of all the people we have vaccinated in St. Croix County, we had one individual faint. And I believe it was a fainting episode related to some of that individual had that day, didn't eat, didn't worked out before coming to get vaccinated. That is the only adverse we've had anecdotally in St. Croix County as St. Croix County Public Health vaccinators. There is a VAERS website, which is vaccine administration, adverse reaction administration reporting. And I don't know, Ellie, if you've looked at any VAERS data. I have not specifically to this point in the response. We do also know anecdotally that your body should absolutely have some kind of reaction, because that's your body's immune response. Really telling you that vaccine is doing its job. If you are getting fatigued, if you do experience a low-grade fever, there are side effects. Now, just because you don't get those doesn't mean the working. I think we have to remember each of our individual makeup is very different, and our bodies will react differently to all kinds of different substance or vaccines or medications that we put in our bodies. So, Ellie, do you have anything to add related to VAERS data?
I haven't looked at VAERS data in comparison to any of our regular immunizations, childhood or adult vaccinations that we undergo as a population. What I have looked at is the extreme adverse effects, so anaphylaxis and death. And so VAERS data is tricky, and it's not tricky, I don't mean to say it's tricky, but you need to look at it for what it is. I've done a lot of previous work in VAERS and related to flu vaccine, and VAERS data will collect everything after your vaccination. So there is a lot of work that goes into the statistical evidence of, is what happened to you post-vaccination statistically plausible that it is related to the vaccine itself, or is it something that just happened to you as an individual due to your own lifestyle and your own immune system, irrespective of the vaccine? And as the data shows now, is that the anaphylaxis and death, there is no statistically significant correlation between the vaccine and those adverse events, extreme adverse events. So right now, there's no contraindications at all being released in terms of vaccines being a source of anaphylaxis or death, or so what we would call a severe adverse reaction. And that's happened all through the trials as well. So everybody is followed in any vaccine trial. There is 2 phases of vaccine trials that are completely dedicated to safety. So where they are going to follow these individuals for multiple months post-vaccination to really make sure that they are okay for release to the public. And that happened for these vaccines as well.
Supervisor Burning, did you have a question?
Yeah, so there's been like conflicting reports between the CDC and also like what's being reported in the news about the vaccines not being effective, stopping a person from being infected with COVID-19. And so I looked on the CDC website, and it sounds as if, and I'd like us to have this so that you guys can maybe assure some of our residents that is it what the CDC says, or is it what's being reported? Is the vaccine effective against preventing someone from getting COVID-19? And from what I can see on the CDC website, it is supposed to be effective. So can you talk to that? And then I have a couple follow-up questions.
Ellie, do you want to take that?
Yeah, I can take that. And Dr. McGinnis would definitely be our medical provider. I have a lot of experience in vaccines and taken a lot of courses and work-life experience in the vaccine development process and all of these pieces. So in terms of the vaccine, I don't watch the news media. I hate to say it. I only read the data and I only look at the reports. I don't even have a TV. So what I can say is that what a vaccine's job is there's a difference between an infection and there's a difference between infection and disease. So an infection is that your body receives the virus, right? Because otherwise the vaccine needs something to fight. And so your body still will receive that virus. You'll still have that close contact. So that's considered the infection. Now, disease is the symptomatic piece. And there is what these various vaccines that we have, they're looking at effectiveness to prevent disease. So to prevent someone from getting sick, to prevent someone from going to the hospital, from dying from COVID. This is the major goal. All of them have very specific markers per vaccine on kind of what their effectiveness is, and that's what that's related to. Now, I can tell you, looking at our COVID data in St. Croix County, of anyone, we have yet to have someone, a St. Croix County resident who has been vaccinated and has completed their 2 weeks to then have COVID and be tested positive for COVID. So right now, what we're seeing in St. Croix County is that we're not seeing an actual infection where they're having symptoms, where they're going to get tested or even close contact going to get tested. We haven't seen that yet. So that's what I can say to it now.
Okay, thank you for that. I don't know if that quite answered, but I mean, I got the gist. It's all good. All right, so you guys talked about some statistics, how we are having less people coming in for testing. And we were really pushing testing hard. And now it sounds like people are fatigued by it. So this is kind of a two-pronged question. So I'm looking for two different answers. One, when did the fatigue of contact tracing begin? When did you notice that? Is that documented? And can we see that at some point in time? Because I can understand that piece of it. Also, we talk about this 5%. Is there any other variation of that 5% that 5% of positive cases being like we're out of orange? When we're looking at this from the perspective of actual like sheer numbers, like 50, you were talking about, I think it's like 58 tests on average, and at one point we were doing 250 a day. Is that correct? You can just shake your head yes or no, or no. What? Can you clarify that? Because from what I gathered from it, and correct me if I'm wrong, if we're doing 58 tests or 58, less testing, and we're still not at the 5%, we're at like 12% positive. Isn't 12% of like 50 better than 5% of 250 or 300? But if you guys can clarify that, and maybe I'm completely misunderstanding it, but that's what I got from it. So if you can clarify that whole piece for me, that'd be great.
Sure. So first, to your point, unfortunately, we don't have continuous contacting tracing data to provide you with, only because we as a public health system were there were just such an inordinate amount of cases that we only had the bandwidth to cover the positive cases at that point. We didn't have, we were not able to go the step further and call those close contacts. So what we were doing instead was just ensuring that the positive person understood the message and was able then to pass the message to their close contacts. If they weren't, then we would take them on. But there did exist for quite a period of time where we were in what's called a crisis standards of practice and unable to perform contact tracing. We have now regained that, and since regaining that midway through the month, Kelly, is that correct?
Sorry,
February?
I
Midway
missed
through
that.
February, we started contact tracing. Again, we picked it back up.
Standards.
Where we moved.
I'm sorry. Yes, February.
February. Yep. So
I don't have a date.
I don't either. I'm sorry. But since we've done that, we've just noticed in our group discussions about kind of our working COVID group discussions on like best practices and how we're communicating with the community, that we've noticed an increase in refusal.
I think what Supervisor Burning is really here is that % positive threshold and kind of what that means. And like, obviously, if you have more cases, your % positive will likely be higher. And I think his specific question, isn't it better to have, and he rattled some numbers off. I think it's
hypothetical.
Right. But I think like the % positive piece is really a hard metric public to really understand. So could you just summarize % positive for the board and watchers, Ellie?
Right. And Kelly's right. I'm just going to preface this with saying that % positive is one metric of many that we look at to help us understand disease burden in the county. So in looking at just % positive, % positive is used for kind of, for example, if we had I'm trying to think of the easiest way to describe it because it is a difficult metric that is used. So say we're testing 100 people, right? We look at, here, let me think. So when you cast a wide net, you have a lot of tests done and you only find a small amount of disease. That's awesome because then we know that we're casting such a wide net that we're covering all the individuals. And so only these people have the disease and we can contact trace them, we can follow them, and we can contain the disease. Now, when we have less tests, it makes it more difficult to know if we're casting that net, because when we have less tests and we end up with more positives, yeah, that's going to kick that number up. So the hard part is having a small number of tests where those numbers you mentioned were just below the ideal for our population to really know where we stand with % positive. And so we're still using the same framework, but ideally we would have a larger sampling from which to be more confident in that number. Does that help?
Okay, so I mean,
please reach out and I will explain it further.
Yeah,
I think you did a beautiful job articulating that, Ellie. And I'd like to address Supervisor Burning's first question about COVID fatigue. We did start taking kind of a list. We have an Excel document running that really looks at when did people kind of start not complying with us, because we had such great compliance right away through the response. I would say probably until the Safer at Home order was overturned. Probably not very surprising to many of you, but I could get you dates on that and when really people started saying, nope, I'm not going to give you my contacts names. So it's not something we could like quantify and probably do beautiful bar graphs for you, but we can definitely give you some indication. We did start collecting that data when we realized the public was at a different point than they had been when they were complying with the questions of public health.
Okay, and then follow-up question even to that is how, looking back now that we're on a year of when like we ran out of toilet paper and rice at stores and bottled water. I mean, I'm being a little facetious there, but we did at this point in time a year ago. How have we done as a county compared to what we were predicting for mortality rate, hospitalization rate over the last year? How have we performed as residents and overall as our county?
Well, I probably shouldn't share my personal opinion related to that. No, I'm teasing. And it wasn't quite a year. You're close, but I was actually in Arizona when we got the first spring Brewers training camp last year, when we got the first notification that we had people at an event where our first positive case, it wasn't our case, it was Pierce County's case, tested positive, and that happens next week. So the toilet paper quickly happened rapidly after that. As far as how have we done in St. Croix County, I think we have done miraculously very. We haven't seen a ton of death. That is true. Have we seen an enormous amount of work that the local health department has had to do? Absolutely. I think that, overall, I don't have metrics for you to say, hey, this is how we compare as to counties like our size, counties like that are like us economically, socioeconomically, how we've done. I have very little information on, the business side of things and how we have done globally as a county to all the different barriers that were put against our businesses related to safer at home. But certainly if that's something of interest, we can definitely bring that back to the county.
Yeah, I'm just looking for how, what it was like we were projected to be at. I know some of the projections were tame. Some of the projections were like, oh my gosh, this is going to wipe out a big chunk of the population in St. Croix County. I just want to know how we've done. Because I think if that's the case, the residents need to be applauded for how they've done and how they've handled themselves, and especially with the influx of Minnesota being shut down and coming over to our cities. Some places probably didn't handle it 100% great, but I think we did a pretty good job. But I'd just like to see the data on how we did that. One other follow-up question on immunizations and inoculations regarding this particular vaccine is, and I don't know this, so I'm not claiming to know this, but just from what I understand, isn't normal herd immunity percentage like 70%? And in this case, we're not just asking for 70% herd immunity, we're asking for 80% inoculation or immunization. Why the difference? Why the difference between, like, say, the polio vaccine and some other ones, and this one? And tell me if I'm wrong. I could be wrong, but just love an explanation on that, please.
So each vaccine preventable disease does have its own threshold of what herd immunity is thought and sought to be. And they do differ. You're absolutely right. Polio differs from mumps, which differs from rubella, which differs from pertussis. Ellie, do you have other thoughts that can better really explain the why behind that?
The only piece that I know is that currently the intent and the promotion of a higher herd immunity is there because we are yet unsure, and people keep talking about these variants, and now there's, so there's always just the intent to have a higher herd immunity dependent, because we are yet unsure how these variants are going to play completely within the immunized population. So the more the better.
That's it. Thank you.
Okay.
Thank you for your time, ladies.
Does anybody else who has not had a chance? Supervisor Achterhoff, did you have a question?
Well, one statement which it hit me when you're talking about lower testing is, I'm on Medicare because I'm over 65, and I just got my statement of charges, and I was charged. I didn't have to pay it because Medicare did, but I was billed $200 for when I got tested when my husband had COVID. Now, people are starting to find out that they have to pay for the testing, and mine was $200. So that's going to affect people going in to get tested. Because I thought the testing was free, but apparently not.
Yeah, it all depends on where you go for testing. And this is something we work extensively with our providers as we've met with them through this entire response is, are we going to just test anybody for free? And obviously, healthcare systems have a bottom line too, that they have to, meet their bottom line. So if people do have insurance or Medicare, they are billing for testing. You may even see people bill charges not for the vaccine, but for an administration fee for vaccine. It's part of our healthcare quandary, I guess, for lack of a better term.
I just figured that, FYI, that could be affecting why some people are not going in to get tested.
Further questions, comments? Okay, thank you for that. Let's see, does that complete your report then, I believe, is that correct? Thank you. Next item then would be County Administrator's Report, Financial Report.
Thank you, Kelly and Ellie, for that presentation today. I never thought I'd say we'll go on to a more lighthearted topic like the financial reports. So when we look through the financial reports, this is the month of January. So the month of January in and of itself really isn't a big enough data segment to provide a lot of comparable data. What I would probably more refer you to is the fiscal year 20. It'd be the first column of numbers on the left there, sort of center of page. That data is pre-audit still, but we have pretty much all of the transactions in. There'll be a few more things trickling in. When we get to page 11, so the bottom line for the county, and this is all of the county funds combined, but 3.3 million in the black. So that means we brought in more revenues than we had expenses going out. That's always a good thing for the county. Every year after the audit, and I come back and we have undesignated fund balance. This is what's causing that. That's a good thing, by the way. But we finish in the black. We have additional fund balance, and this is spread through all the funds. Well, this isn't all going to go into undesignated. This affects all of the funds. But we're in the black, so that's a good thing. So I would point that out in the financial report. And then the next page, our interim finance director has updated our capital projects for the 2021 projects now. So you can see those projects. There's still a few that are carrying over. You can see they have prior year budget numbers, and then all of the new projects that are on there as we start working on our current year KIP projects. Other than that, I will open it up for questions on the financial report.
Judy Otterhoff, nothing on the finances except on the KIP. On page 12, line 7260, it's under public protection. We have the phase 2 radio system upgrade, which we originally came on in 2015. So you're looking at 6 years ago. They've done most. How close are they to actually completing that so that we can take it off?
Yeah, they are close. So I think the last item they were waiting for was a water tower rewiring. They were going to rewire an antenna. The painting of the tower got pushed back, so they ended up having to push back, changing out the wires on that water tower. I believe that is the last cost that's involved for that project. They really should have closed that out in 2020, if not for the delays on that project.
Okay, so this should be done this year then?
Yes.
Hopefully.
Yes, I've told them that it will be done this year.
Okay, thanks.
Further questions for the administrator? Seeing none, we'll move on then to the report on federal and state funding proposals.
Yeah. All right. So back to heavy topics. So I just lost my page here. Yeah. All right. So the federal government and the state government both have proposals that are in process right now. I'm bringing it forward because it's really a big deal. Both of them, in their current format, would have a significant impact on county operations. The federal stimulus package, in all likelihood, looks like it's going to go through. I think it's held up right now because of the minimum wage, which wouldn't have a very big impact on us. I think only our seasonal employees are below the $15 that's being proposed. I think our seasonal parks start at $12.56. That's our lowest wage rate. All of our full-timers are over that $15 minimum. But really the bigger part of that is that $1.9 million, there is a direct payment for counties. So every county in the United States would receive a check directly from the federal government. And the check that St. Croix County would receive, based upon the projections that NACO has made, is over $17 million. So, you know, we had stimulus money last year that we were able to spend, and we spent a couple $100,000 over it, but it was $1.4 million. So this would be a $17 million check that we would receive from the federal government. So it's kind of a big deal. I thought I should tell you about that. I think there's a question from Supervisor Burning on that.
Go ahead, Supervisor Burning.
Is there any insight into the restrictions that would be put on that, or are those going to be unrestricted funds?
There are restrictions. On page 301 of the budget document, it lists 4 restrictions for that. So the use of the funds are respond to or mitigate public health emergency. So that's, you know, the stuff that we've been doing. So we can continue that. Cover the cost incurred as a result of such emergency. So that's maybe the couple $100,000 that we didn't get reimbursed for last year. So those are direct costs to the pandemic. Third then is replace revenues that were lost. So we do have some revenues that lost. The number of passports that the county clerk's office issued was down. So there's thousands of dollars there that we lost out on revenues. And there may be more throughout the HHS where services were restricted, not 17 million worth out of our $100 million budget, but there are some lost revenues. And then the last one is address the negative economic impact of such emergency. That one's probably the broadest category. So how do you define negative economic impact? So that's the one that we would be looking for additional guidance on, but the one that probably would have the most flexibility for us and how we end up utilizing that money.
Is there a time frame in which they want us to utilize these funds or use them?
So these, my understanding of the funds is we tell them to send us the money, they send it to us, and we have to certify that we had used it for one of these items. I don't know about a time frame of when it's going to be used. I would imagine it's not a short time frame, it's not months, but it's probably not multiple years. So somewhere in between there. And the reporting requirements, for what I heard, are not going to be very stringent. I don't think they're going to ask you to detail out like we do on grants to report back every last expenditure that we had. They're going to ask for a certification that we had spent it appropriately.
I'm sorry, it says no vacations in Hawaii for the county board either.
Thank you for clarifying that, Mr. Chair.
Judy, I think, has a question.
Yeah, I got another question then. Then who decides who spends the money or how the money is spent?
Everything that the county board spends is authorized by the county board. I see lots of nodding, smiling faces here, so I got the answer right.
Okay, thank you.
All right.
Further questions for Ken?
Yeah, so that's the federal one. The state one then, if there were no other questions on the federal, we're going to the state. So the state one, the governor had made his budget proposal. Now this one is a lot less likely to go through and intact in the way that the governor addressed it. There is a difference of opinions on some of the things he had. Some of the issues in there, though, would have a significant impact on the county. I'll highlight just a couple of them. He had proposed a 0.5% sales tax if it's approved by a voter referendum. So our sales tax collection per year is $9 million. Our tax levy on property taxes is $30 million. So that would be a significant shift for us, shifting from $30 million in property taxes and $9 million sales tax to down closer to $20 million in property and $18 million in sales tax. So that's a big shift for us. That'd be a big deal if that proposal would go through. A 2% increase in shared revenues. We don't get a lot of shared revenues. That's really more of a city level, but there is an increase there. 2% increase in general transportation aids. Those all go to highway. There is the 10-year renewal for the stewardship program. That's actually the next item that's on the agenda, is endorsement of that proposal. That was in the governor's budget proposal. There's a $15 million increase for TAD funding. We do receive $147,000 or $146,214 of TAD funds per year. That is double the amount of TAD funding, but there's more and more counties that are doing TAD funding. That's a 5-year cycle. We're coming up for renewal next year on that, so that'd be good if there are additional funds available. $10 million increase funding for local health departments. So you just met Kelly there a little while ago. That would be going partially to her. Significant investment in mental health. So we've talked about that at the Public Protection and Judiciary meeting and at HHS. So it's good to see that some resources would be invested into that. 11.8 million additional funding for county child support services. If you remember Lisa's report from a couple months ago, she had talked about that. And then there's also $200 million in broadband investment. I know broadband has been a hot topic around here also, so the governor has some money allocated for that, which is 4 times higher than he's had in past budget cycles. So there's a lot of things in there that would have an impact, a couple of them significant impact. So I bring it up so that if you do support or oppose any of the ideas, you can reach out to your legislators, because now would be the time to provide that input and get the things that you want or to stop the things that you don't want in there.
Supervisor Fiedler.
Just a quick comment. You may start out. The administrator went through a number of areas. One of the things that was also an increase was $200 million for small business, including a $100 million venture capital fund. So that's a huge benefit to our small businesses that have suffered. I was a little bit slow, Ken, on following the 0.5% increase in sales tax if there was a referendum. I understand how that worked, but then you went on to comment on how much we got now in sales tax and how much we got in property tax, and then you projected the new rates. How did we get to the new rates?
Well, my understanding is if the voters elected to do an additional 0.5% sales tax, we went from 0.5% to 1%, our collections would double. So we collect $9 million right now, we'd collect $18 million then under the new one. But that wouldn't be just $9 million of new money for us to spend. I would see it as a new way of funding county operations, so you'd be reducing property taxes. And I mean, maybe you use $1 million for new money and maybe offset by $8 million. Maybe there's some ratio there that you would do. But I don't have $9 million of additional funding. Maybe if I asked my department heads, they could spend that. But I would see it as a shift in how taxes are collected, not in all additional funding for counties.
Just one more question, and you probably explained it very clearly. I just didn't understand it. As I said, I think wasn't the proposal for a 0.5% increase in sales tax? Mm-hmm. So how did we get to a doubling of it? Because we already have, or you're saying that right now we have 0.5%, and we're going to 1%. Got it.
Yes. Yep. The county portion, correct. Yep. Yeah. So your total tax, sales tax, then if you went to Target and purchased something, is 5.5% right now. 5% for the state, 0.5% for us. So then it would be 6%. 1% for us, 5% for the state. And again, that would have to be, as the governor had proposed, it's subject to a voter referendum. So that's a longer term prospect, but it's a really I actually really interested in that proposal because it cost shifts where we collect our taxes from. And we'd have to do an analysis, is that a good thing or a bad thing? But it would be definitely a tool for us to be able to look at, to use.
Okay, I guess that kind of...
That wraps it up.
Okay, thank you, Ken. Okay, next item of business then would be resolution supporting reauthorization of the Knowles Nelson Stewardship Program. Ken? Do we need a motion to bring that forward? Or?
Yep, there'd be a
Okay.
motion in a second, and then either Supervisor Hanson or Ellen Denzer will take it.
Supervisor Long makes a motion. Do I have a second? Supervisor Counter. And go ahead, Ken. I'm sorry, who's covering that?
I will, if you can hear me. Can you hear me? The Knowles Nelson Stewardship Fund has been around since 1989. It's been vital in preserving and developing park and recreation land across the state. It's been vital in St. Croix County, most recently to purchase parkland along the St. Croix River and also to develop a group of campground facilities in Glen Hills Park. I would ask that you vote for this. What we're doing is sending along our endorsement to the legislature and to the government. So if you have any questions, I'm sure Ellen could handle that. I'm working off of my telephone tonight. It's just been horrible. Thank you.
Questions?
Yeah, I'm wondering what happens if this does not pass in the budget. What are the consequences for the county?
Hang on. Can you hear me?
Go ahead.
There we go. I was trying to get my video on. So St. Croix County has applied. It won't affect anything we have going right now. Once a grant from the stewardship program is awarded, the money is set aside by the state. And we do have right now a $250,000 grant towards our group camp project out at Glen Hills. But it would affect us as we move forward because we are planning on utilizing grant funding to help us with development of our other new parks, specifically the new park, Eckerd Blufflands on the St. Croix. And we have also used it numerous times in the past. We used it to purchase additional land at Homestead. We used it to supplement the mitigation funds. We used it 20 years ago when we developed Homestead Parklands on Perch Lake. A great deal of that money came from the stewardship program. So it's a very vital program that's used by a great many communities. It's a really great thing about it is not only is it available for acquisition and development of new parks, it's also available for redevelopment of existing parks, not ongoing like yearly redevelopment, but when a few years have gone by, you go in and you say, geez, these things are, facilities really need a complete facelift. And we have used it in the past to give our Glen Hills Park and some of our other smaller parks a complete facelift in certain areas. So it is a very valuable program statewide, and it has done an awful lot of good for maintaining our parks. And I think that it's valid to support it and try to support it at a funding level where everyone out there gets some money for various projects.
Go ahead.
Mr. Chair, can I add one thing?
I'm letting Supervisor Burning
Yeah,
finish
can I
his
follow
question.
up if you don't mind? So this $50 million is throughout a region on the St. Croix River. Is that correct? That's not just. I mean, obviously, it's not $50 million for just us.
No, it's for the state, I believe, the whole state.
Okay, and so this goes towards like capital projects that we have done, like some of the improvements you were saying, correct?
Yes, for instance, the acquisition on the St. Croix, we got an $800,000 grant towards that acquisition. There was also quite a bit of mitigation money and DNR mitigation money. I mean, that acquisition was $4 million. The acquisition of the land that we've added, the 40 acres we added to Homestead Park, was in combination with the town of St. Joseph, but the county's grant portion was in the hundreds of thousands of dollars.
So
right now we have a $250,000 grant.
In asking for this money right now, are there other counties that are dependent on this money to do any big projects to help with land preservation or protecting our watershed or anything right now? Or, I mean, is this something that the taxpayers need to take on today when we still are going into unknown COVID land? And
I believe
would it
this
be,
is this is a 10-year reauthorization of stewardship for the next 10 years. It's not 1 year.
right? Yep. No, I understand that on the resolution. I saw that. what would the drawback be for the region if we did not request it this budget cycle and we went to the next budget cycle until we figure out what's going on with COVID and the economic
I can't
impacts?
really answer that part. I can't really, I know that I'm sure there are a lot of communities that are applying for grants for this year, for 2021. We usually, when we have a grant, we try to spend it and do that development before we apply for our next one. That's what the DNR prefers. I'm sure there's a lot of communities. I can't speak to others. There are other communities in St. Croix County, City of New Richmond, City of Hudson, City of River Falls, Baldwin, I know Glenwood area. They have all gotten stewardship grants in the past. So we're not talking just counties. This is cities, villages, towns. Town of Troy has gotten a stewardship grant in the past.
Please, somebody else
you.
on the, which one? Supervisor Hanson, go ahead.
Thanks. I think Ellen did touch on this, but I wanted to add that this isn't just parks. Parks is something that we've used it for, but we've used it in our parks for preservation. We preserve wildlife habitat and water quality, fisheries. That's the foundation of these monies. That's the reason that it was put into place originally. And when you write the grants for these, the preservation of these habitats and our natural resources is the foundation of what these monies are used for. Recreation is part of it, and the recreation areas that we invest this money into are also part of that mission, is to preserve these areas for wildlife habitats and for water quality. So it's important to remember that it's not just for going out and having a playground, it's for preserving our natural resources as well. So I wanted to make sure that we focus on that too. This is a wonderful thing, and it's very much worth preserving. So what we're doing is forwarding a request to the legislature to vote for this. Thanks.
Supervisor Achterhoff.
Hopefully I understand this correctly, is we want a 10-year continuance, which doesn't mean we're going to use it next year, depending on what COVID does. But it gives us the ability to say yes or no. Whereas if we don't do it, we can only say no. Is that kind of correct, Ellen?
You saying we? By we, do you mean
the county? Or, well, if we say
the county, let me explain. There is no money coming directly to St. Croix County. This is for the state of Wisconsin to reauthorize the stewardship program. So it's not St. Croix County, it's the state, and then their decision for the next 10 years of funding various activities. This also goes to fund state parks, state park improvements. This one stewardship fund is used for state, county, city, town, all levels of government funding of, we budget money and every community budgets money, and obviously the state budgets money, but this is a special program basically to apply. We all compete to apply.
Okay, and maybe I should know this, and I'm ignorant. Does it come up every 10 years that we have to approve this? Is this why we're doing this now?
Yes, it has a 10-year reauthorization that
okay.
And every year as the resolution background paragraph states, the legislature can change the amount of money. It says anywhere from in the past, anywhere from 33 million to 86 million is what they have done. They're asking for it to be a little more consistent at 50 million, but they can change it. This is the most important part of this, in my opinion, would be getting it reauthorized.
Yeah.
Keeping the program
I agree.
going.
Yep, I agree. Thanks.
Supervisor Fiedler.
Just a quick update. The resolution is correct that the WDNR did request $50 million, but when Governor Evers proposed his budget 2 weeks ago, he included $70 million a year with a 10-year extension and a $700 million bonding authority. So I think this is going to roll through the legislative branch pretty quickly, probably in that $50 to $70 million range.
Further questions? I believe we're ready to vote at this time then. So once again, it's the resolution resolution supporting the reauthorization of the Nelson Stewardship Program. All those in favor signify by saying aye. Aye.
Aye.
Opposed? Carries unanimously. Thank you. And the next one then would be resolution amending 2021 budget 2. Kevin. Do I have a motion for that to the floor, please? Supervisor Long? Second from Supervisor Osnerson.
Did you want to introduce it at all, Supervisor Long, or do you want me to take it?
I think it would be better explained by you, if you don't mind.
I just want to make sure I offer it to you. I was hoping anyways. All right. So resolution amending the budget. This is the second amendment for the 2021 budget. This resolution is really doing three pieces that are independent of each other. You can take them all together in this resolution, or you could break them apart if you wanted to. The first thing it's doing is it's funding a position in the Community Development Department that's grant funded. The grant starts on April 1st, and it was for, let me back up just a little bit. It's for the grant project technician who's going to be working on the Willow River Water Quality Project. So that grant lasts for a couple of years, and the position is temporary based upon the grant. So when the grant is finished, that position would be finished. If it needed to be funded through tax levy, we would bring that back before you to have that change made at the end of the grant. The other position that we have then is the epidemiologist position. That position is currently an LTE position. You saw our epidemiologist earlier. The HHS and the Public Health Department would really like to make that position a regular position for the county, and with the intent of keeping it moving forward. They've found a lot of value in the epidemiologist position. I know Bob Rohr, the HHS director, at yesterday's meeting had talked about how that position does analysis, and it can be used greater than just the Public Health Department. It can be used in other divisions within HHS to allow them to focus care where it's needed most. You know, having our staff work smarter in the areas where there's the greatest need. That's what the epidemiologist does through data analysis of disease. So it is currently funded through a grant, and that grant does carry that position all the way through October of 2022. So it's funded all of this year, and it's funded for 3/4 of next year. The difference between an LTE position and a regular position, they want to change it from an LTE to regular, is the long-term prospect for the person that holds that position and benefit eligibility. So an LTE position is not entitled to benefits, and their position is tenuous because it's going to end at the end of the grant. They would like it to stay on. They do like the person they have now. That person would have to apply for the regular full-time position, but knowing the work that they do, they would have a very good chance, I think, of getting that position full-time. But they would like to provide that security. They would like to potentially retain that employee, and they would like to have this position long-term. So just so you understand, this year, fully funded through the grant, 3/4 of next year, but you would be, you know, kind of locking yourselves into at least allocating in the draft of the budget 1/4 of a position out of the 2022 tax levy money. And then in 2023, that full position would be tax levy supported money. So as long as you fully understand what you're getting into with that position. The third piece then, I'm going to scroll down to the bottom of this, was a reallocation of some of the positions. So as I looked at the positions through finance, administration, and HR. Wanted to realign some of the resources we had. So it starts with eliminating the assistant county administrator position. That position is now vacant. That position had done the finance director job. So if we eliminate that, that position in the job description was responsible to be the finance director. So we have to replace that. My proposal for replacing that would be the reclassification of the assistant finance director to the finance director. That person has been doing the job on an interim basis since August of last year, has been doing a good job, has been able to absorb all of those job duties. So I think the workload is satisfactory there, that we can eliminate the assistant finance director, make a finance director. We've eliminated the assistant county administrator. So that's part of the shuffling there that we're doing. The other change I would like to make is the elimination of the executive administrative assistant that was split between HR and administration, and create a full-time administrative assistant position within administration. So that picks up some of that workload that we lost through the assistant county administrator, providing some of that. There was a provision that the administration committee asked for additional information on with the position that I wanted to create within the HR. So we're going to bring that back at a later time. But just know that through all these changes, we're actually down 1 FTE right now. So that's the proposal. Hopefully I've explained that well enough for you. But if not, I'd entertain any questions on the grant technician, the epidemiologist, or the changes in this administrative reallocation.
Supervisor Burning?
How are we down 1 FTE when we've got 5 added, 3 negatives? The epidemiologist is funded through this year and 3/4 of next year. The grant project technician is funded, and then you said it's an LTE?
Yeah, it's a fully funded grant position.
Yep, no benefits, or what is that one?
So it would be it'd be a regular position for as long as the grant was there. So it would be a benefit eligible position.
So then what happens when the grant falls off?
So we know that coming up, and that employee's position at that point is eliminated, or the county board has to make the decision to change it to a tax levy funded position.
Okay, and then we're getting rid of the assistant county administrator position, executive administrative assistant, and you're saying that executive administrative assistant was doing 2 jobs anyway?
They were split 75% HR, 25% administration.
And you're just moving that into the HR department instead, so they're fully devoted to the HR department, or are they still going to be supporting administration?
Yeah, so the employee that was in that, we've actually moved to an interim role in HR as an HR specialist. So that position is vacant currently. So we're going to create an administrative assistant position that would be 100% within administration, although they will technically probably still pick up a few of the administrative tasks out of HR. So when I said that we're down 1 FTE, it's really split into 3 blocks. So
Okay.
I was only referring to that final block that we're down 1 FTE. So if you look at just the assistant finance director down on the positions, so it's a -1, +1, -1, -1, +1. So that's the -1 net that we have. The other 2 are grant funded, so I wasn't counting those at this point in time.
So the assistant, okay, I'm sorry, one more time.
Yep. So let's look at it from a total department perspective. So right now in the administration department, we have 3.25 FTEs. So we have a county administrator.
Yep.
We have a public information officer. We have an assistant county administrator and 1/4 of an executive administrative assistant. So we're going to drop the 1/4. We're going to drop the assistant county administrator. We're at 2. So I have the county administrator and I have a public information officer. I would like to add a full-time administrative assistant. So far, good with administration?
So the assistant county administrator was a position that you held previously?
Correct.
Oh, okay.
I did that job then, and I've been doing that job since August. I can probably keep doing that job.
Yep. Okay, thank you.
All right. That answer? Okay. All right.
Further questions? Supervisor Long.
I just want to provide a little background on our discussion at the administration committee meeting from yesterday. I know this is a really complex budget amendment, and there's a lot of intricacies. We did talk through all of it, and we really agreed on virtually everything, with one exception, and that had to do with the epidemiologist. First, I want to say we totally all agreed on the value and the need for the epidemiologist. There wasn't any question there. As a matter of fact, Supervisor Ard made a very compelling argument and the need for that particular position. But where we did have some disagreement was on the process. So this particular position is grant funded through October of 2022, and Supervisor Cook and myself felt that it was probably, or it really is more appropriate that we allow that position to go through our normal budget process in terms of approving that as a permanent position. And the reasoning being, we have that budget process for a reason, because we need to look at staff additions in all of our departments at the same time. Because if we look at them separately and individually, they may look really good. You know, wow, that one looks good, that one looks good, and then all of a sudden you've got all these staff additions like, well, wait a minute, we need to look at the bigger picture. So I really believe that it's our obligation, our responsibility to make sure that we're looking at all staff additions from all department requests so that we can appropriately allocate resources in the right areas. So Supervisor Cook and I really, we did really decide that we really wanted to have that part of the process. I would have every reason to believe, quite frankly, that this particular position, the epidemiologist, would be approved and be part of the budget. But at the same time, I think the process is really important. So I'm interested in others' opinions on that so that we know what the right way to move forward with this.
Go ahead, Supervisor Burning.
Okay, so we're doing all this jumbling right now, as Supervisor Long pointed out, prior to our budget, budget presentation and budget allocation. What would be the effect of not doing any of this now and waiting till the budget cycle discussion to come in? So it's a broad picture for everyone, and, quite frankly, it's part of the whole proper budget cycle. Do you understand what I'm saying? And can you answer what the ramifications would be if we didn't do this now? And then what would be wrong with moving this to the regular budget request cycle time?
So there's three things that we're doing with this, and each of them could be split separately. So the grant project technician that community development wants, that grant starts April 1st. So we would like to get that position filled by the start of the grant so we can fully utilize the time period that the grant's available for. So there's a really good reason for that one. The epidemiologist one is really just, we like the person that we have there. We really want to provide some security. We want to be long-term with that position. That's the reasoning behind it. And the third one is a reallocation of resources that actually has a net savings for the county. And right now, and really since August, I've been lacking on support. So I'd really like to get that administrative assistant position created and filled. And then if you're eliminating the assistant county administrator position, we need to address the finance director position because we want a finance director for the county. So if you didn't do it, it really just means more work for me, really. That's probably the net result on that one. But that's a net savings for the county. So.
Okay, and then like the grant project technician, how long ago did we have this coming down the vein? Because I'm finding it kind of odd that we're at March 2nd and we need it April 1st and it's just now appearing.
Yep. So we write the grants, and then we receive notification. Ellen can correct me if I'm wrong, but it was either right at the end of January or early part of February that we received notification that we received the grant and that it would be starting on April 1st.
Correct.
Okay, that makes sense. So why are we putting all of these on one resolution then? Is it just for time's sake, I guess? Instead of, like, because it just seems like some of these are, it's just jumbled. It's a lot to ask on one resolution, and I mean, some of this, like the grant project technician probably could have been its own resolution, and we could have voted on that and had it out of the way for Ellen and her team. But the rest of it just seems like we're coming out of a off cycle for the budget requests. And
I'll just interject something here, and Supervisor Long can agree or disagree. He can check me out here. The administration committee walks a very tight line between what we would consider micromanaging and what we would consider, oversight. And in this case, I would assume that or think that most of the committee was thinking that these were areas where he had the right as a supervisor, a manager, to make those moves, and it wasn't controversial in our sight. Supervisor Long did bring up the one area where we had questions. Correct me if I'm wrong, Bob, but I think that would be an accurate description.
Yeah, absolutely. It seems very appropriate, and we're really letting county administrator take the lead on these issues, and some of them really should be pretty straightforward. It was primarily the epidemiologist, the timing of considering that position that Supervisor Cook and I had an issue with. So that particular piece could be pulled out as a separate item. We can take care of the rest of this, but I wasn't going to go down that rabbit hole until I got some other feedback from other supervisors as to whether or not they felt that was appropriate.
Supervisor Leaf.
Yeah, so I watched the administration committee meeting and I heard the discussion about that, but yet it passed unanimously. Even with your concerns, I think it's essential that we get the epidemiologist on board. I did have a question, Ken, about the assistant finance, the finance director. So it appears that Ellie would need to interview for her job, but yet we're trying to appoint a finance director. Is it just because of the different classes of employees, or what's the difference?
Yeah, on the epidemiologist, it was a 3-2 vote, 3 to retain the epidemiologist in the budget amendment, just to clarify that. On the finance director, so it's a little bit different. That position is really a true reclassification within our system. We do new hires, we do regrades, and we do reclassifications. So the difference is a new hire is a new position for the county. So while the epidemiologist is an LTE, it's not really a full-time position with the county yet. A regrade is when we take a look, because we had one of those yesterday also, administration. A regrade is when we're looking at a position and adjusting where it is on the grid based upon market conditions and internal comparables. And a reclassification is when the employee is already doing the job and we're changing their grade and title to match the job that they're doing. And that's really been the case with the assistant finance director. They've been doing the job of the finance director since last August, and their existing position wouldn't exist anymore after the budget amendment. So that's where the difference lies.
Okay, thank you. And I guess when I was watching it, maybe I was confused by the order of the motions, but I did think that the budget amendment 2 did pass with that language in it, but maybe I was wrong.
Supervisor Anderson?
So correct me if I'm wrong, but this is taking like 3 top level positions and turning it into 2. You used to have a county administrator, assistant county administrator / finance director, and then a finance director. Now that's just becoming a county administrator and a finance director. And then that third position is get put into administrative assistant, which is obviously lower on the scale.
Correct. Yeah, we're taking the assistant finance director, assistant county administrator, eliminating those two, really going to the finance director, and then changing that executive admin to an admin assistant, which is a couple grades lower.
Supervisor Osnes.
Yes, if you don't mind, Mr. Chair, I'm wondering if our HHS director would like to chime in.
Bob Rourke, did you wish to speak on this issue?
Oh, thank you, Mr. Chair. Well, I can speak briefly to it. I think Ken did a nice job of summarizing our needs here. I would just say that I can see the utility of having an epidemiologist in our human services department, not just in public health, but I can see the value as a public health professional myself in using those skills to better target and better design interventions for other human service departments. I think my concern here is that we have somebody of a very high caliber already in our employment as a limited term employee. There's a high potential that if we don't act sooner than later, someone else will come along and take her from us. And I understand it's an open, we would have interviews and interview any applicants that would apply. But to lose someone of that caliber right now, I think would be a shame. And that's why I'm strongly in favor of acting sooner than later on this. But thank you.
Supervisor Ard.
Thank you, Mr. Chairman. Fellow supervisors, I will state to you, as I stated at administration, in my work, I am dealing with numbers all day, and those numbers translate into people whom I also deal with. Having an epidemiologist as a full-time employee for the county is not just serving health and human services. It serves almost every department we have in the county, but more so, it is a support basis for law enforcement, for emergency medical services. Because of the data analysis that an epidemiologist will provide regarding mental health, AODA, elder abuse, child abuse, domestic violence, all of this data has to be translated. And once translated, it can be put in to a program. Programs can be changed. Those numbers represent people and change, what we have perhaps missed in the county. And that all translates into dollars saved. Once data sets are identified, once communities are identified, groups in need are identified, we can make those changes. And as I said, if we'd had an epidemiologist 5 years ago, we'd be having a very different conversation today, even in our response to the COVID-19 crisis. I cannot urge you enough. We have an excellent epidemiologist on staff, and make no question about it. This is an epidemiologist who will be snapped up sooner than later, because on the short-term employment that she is currently on, she's already going to be looking for positions, or some of those corporate headhunters are going to be looking for her. So I urge you to vote for the epidemiologist and make this a full-time position.
Supervisor Hanson, I believe you had your hand up. Okay, Supervisor Achterhoff, we'll come back to Supervisor Hanson.
Okay, two things. One is that we've done stuff like this before. This isn't costing the county any more money except for the, and I won't say it right, epidemiologist, and I think that's incredibly important. And all of these job additions, movements, whatever, are going to help the county work more effectively and efficiently, and thus serve the public we are there for better. So I kind of agree with all of them. And the one thing, this kind of doesn't fit in, but on page 23, lines 26 to 29, you did a staffing analysis. And I find it, I don't know what the word would be, but you did the staffing analysis for admin, finance, and HR. And by God, you had to do changes for all three of those. Are we going to do a staffing analysis in all departments of St. Croix County to find out how we can improve and serve the public better with changes in that regard? That kind of is not here, but that was in the resolution. So I don't know where that would go and where I would approach that. But I feel it's very important. And that would go to you, Ken.
Well, Supervisor Octroff makes an excellent point, but we actually do a staffing analysis anytime there is a vacancy. That's what triggers it. And so every time we have a vacancy, we take a look at that position. Is there a better way of doing it? Is there a different place where those job duties can be? That's one of the things that HR takes a look at every time that a vacancy does occur. And that's what triggers this analysis.
Last year, we had 77 resignations. Does that mean we did 77 staffing analysis?
To some extent, yes, we did. We do take a look at every position. You know, when a CNA position at the healthcare campus comes up, do we do a very long staff analysis before we fill that CNA position? No, not really. But if it's a position that's within the management structure, that usually takes a little bit longer because that usually provides a little bit more flexibility for us with different options. So it depends on what the position is, but we do take a look at that every single time that a vacancy comes up.
Supervisor.
And this is the, okay, yeah.
Supervisor Hanson, are you back on yet? I believe we've lost him. Any other questions on anybody who is not?
I just wanted to make a comment that if it's we're eliminating 3 positions and we're creating 3 positions, so it's as of right now it's not going to cost us any money. So I can understand where you were coming from on the budget cycle, but right now it's not costing us anything. So I think we should go ahead.
Further questions, comments? I believe we're ready to vote then at this time. What Supervisor Osnes?
Do a roll call vote,
yeah,
please?
that will be a roll call vote. Cindy, go ahead and start.
Ed Schockner?
Yes.
Sean Anderson?
Yeah.
Bob Long?
Yes.
Kathy Leaf?
Yes.
Carr is absent. Tim Hall?
Yes.
Paul Burning?
Yes.
Rick Otino?
Yes.
Bob Fiedler?
Yes.
Dave Osnes? Scott Connor?
Yes.
Dan Hansen?
Yes.
Scotty Yard? Scotty? Yes. Is that a yes? Okay. Greg Telejohn?
Yes.
Dave Peterson?
Yes.
Paulette Anderson?
Yes.
Judy Achterhoff?
Yes.
Shelley Tomschick?
Yes.
And Bill Peavy?
Yes.
Unanimous.
It's unanimous. Thank you. Next item then would be appointment of Finance Director, Leah Symington. Motion, I'm sorry. Supervisor Long. Second by Supervisor Peavy.
Leah Symington, who's, I guess, technically currently unemployed, since she eliminated the Assistant Finance Director job. She hates that joke. She has a bachelor's degree in accounting. She has 20 years of accounting experience. She has 7 years of experience in county government in accounting. And she's been performing the job duties of the finance director ever since August. I've transitioned all of those duties over to her, and she's done a great job with it. And as I said at administration committee last night, one of the things I hate to admit, she's probably actually even a better accountant than I am. So it's not something I admit very often, but I wholeheartedly recommend her to the county board for appointment as the finance director.
Questions, comments? I believe we're ready to vote then at this time. All those in favor of the appointment of finance director signify by saying aye. Aye.
Aye.
Opposed? Carries unanimous. Thank you. Congratulations.
You got a job.
Yes, speech. I just wanted to thank all of you for this opportunity. I am very excited for this role. I have been working very hard at this for the last 5 years. I will continue working hard, providing accurate financial information and improving the finance department. I look forward to this adventure and to working with all of you. Thank you so much. I appreciate it.
Thank you. Okay, we'll move on to annual department reports. Administrator Witt, I guess you're first.
All right. I'm going to flip to that. The report is in the packet. A lot of it goes over the prior year data and work plan. I wasn't going to spend really any time talking about that information. If there's any questions, I'd be happy to answer them. I was going to give you just a brief update on the work items for 2021. So the first work item that we have for 2021 is the Government Center project. And so we have our first Planning Committee subcommittee meeting coming up on the 24th of March. So that one is in progress. The second item on there is strategic planning process. We have the kickoff scheduled for that. We've hired a vendor, WIPS, which is the Wisconsin Institute for Public Policy and Service. They have experience doing strategic plans for other Wisconsin county governments. They're kicking off with us at the next county board meeting on April 6th. We should have a strategic plan by the end of August if we stay on target. The third item on there is to do an employee town hall. That is in the planning process. We're looking at doing that somewhere at the end or beginning of the first quarter or beginning of the second quarter. The fourth item on there was to conduct a community survey. We did that actually last fall, so that item is done. And then the fifth item was adopt a budget process changes. So we're doing that. We're having a committee of the whole meeting on March 19th to start that new part of that process. So all of these items are in progress. And the other two items that I would mention that sort of came up that weren't on my original work list was broadband. So we do have the RFP for the broadband out. Those bids are due at 3 p.m. tomorrow. I've had several vendors contact me saying that they're going to bid. I have not received any of those bids yet, so hopefully I do receive them tomorrow. And then one other item that I came up with was a citizen interest form, and you can find this now on the city or the county's website under the County Board Supervisors page. So in April and May, we have a lot of citizen appointments coming up. So I don't know everybody in the county. So I created a method for citizens that are interested in serving on committees to express that interest. So there's a form that you can find on the county website from the County Board Supervisor page, citizen interest form. You can fill that form out. We'll get that into a database then, and we can match up your expertise with the vacancies that we may end up having, and that's how I'll plan on filling vacancies in the future. So that's what I have to report. Are there any questions on the county administrator's report? No, I don't.
Okay, no questions. Thank you, Ken. Then our next department report would be Corp Counsel Cox.
Good evening.
You've got my report. I apologize that the right column was cut off a little bit. I guess the highlights for 2020 was the additional, or the workload really was changed so that we spent a lot of time on public health issues. I've been a corporation counsel for 26 years in 2 different counties. Never spent nearly the amount of time on public health issues that I did, and one of my assistants did in 2020. 2020 also was the news that one of the assistant corporation counsels in the office, Liz Roll, had secured an appointment to be a judge, next judge in Pierce County. And she actually left in January. We have hired someone to start on March 15th. So we've been without an assistant corporation counsel for about 2 months. Projects for 2021 include working on updating the county's floodplain zoning ordinance, realigning and working on various other ordinances, codifying them in a new electronic system that will be easier to access for the public. And once again, thank you for your support for our office. And if you have any questions, I'll be happy to answer them.
Question? Seeing none? Thank you, Corp Counsel Cox.
Thank you very much.
Next one then would be annual department report, Human Services. Tara?
Can't hear her.
Turn the mic on.
Oh, okay. I thought we had to squat. Okay, I'm sorry. I said good evening. I know it's getting a little late, so I'll try to make this pretty brief. There is information on 2020. I wanted to focus a little bit on 2021 goals that we have. I'm excited that we are able to continue to offer the leadership trainings that we offer on a quarterly basis. We've been able to bring in some outside presenters, also do some internal training. I've connected with UW Extension and some of their providers, so they're going to be working with us as well to offer some trainings this year. And then by a popular request and by necessity, we've had a lot of staff ask for training and development opportunities for outside of just leadership. So we are going to be offering more of that this year, all staff trainings. How that looks is going to depend on the landscape, if we can do that virtually and in person, but we definitely want to be able to offer some trainings for all staff. We are going to be sending out some surveys or questionnaires to find out what employees are interested in as far as development and training. We're going to add to that survey also, and this part's not on your report, but we are going to be asking them to give us feedback on the Human Resources Department in general. What is working for them, where are our opportunities, and where are we succeeding? So we want to make sure we do that, and we're going to be partnering with our PIO, Adam, for that. Additionally, we don't want to get employees to get survey fatigue, but we do want to do an all-county culture survey. And so again, working with Adam, our PIO, on that as well, so we can have something we can measure year over year to see how employees are feeling in general about employment at St. Croix County. So those are some exciting things we're looking at. A couple others I just wanted to mention is some of you probably, or all of you, know that we've been working on our handbook. It's been a little bit of a slow process to date, but this year we've really stepped it up, and our goal is to have the complete handbook revised by the end of this year. And then we did establish some new benefit offerings this year, so we really want to see what those metrics provide for us to see if they did help employees and the county cut costs and helped with our overall health and wellness for employees. And then lastly, one of my big initiatives that I'm excited about this year is to increase our diversity, equity, and inclusivity efforts. I'd really like for us to get a robust program here at St. Croix County, so that is going to be one of my primary goals for the year, is to work on that. And with that, are there any questions I can answer?
Questions, Supervisor Long?
Hi, Tara.
Hi.
Say, 2 quick questions for you. 71 resignations, were there any particular common themes as to their reasons for resigning? And then also on the age band the length of service diversity, I was surprised that over 40% of the workforce has only been here between 1 and 3 years. Is there a particular reason behind that, or I was really surprised at that?
So I'll address the first question first. As far as resignations, what we've seen a lot of resignations is some of those are seasonals, so we would expect to see that. Some of those are short-term employees and seasonal work, so that's some of the majority. Then there is also those that have left for better paying jobs. Sometimes that happens. They've got a better paying job somewhere else. Career opportunities. I actually just lost one of my staff in February because she was given an opportunity to grow and develop into a different role, and I wasn't able to offer her that here. So those are some of the reasons why we do ask everybody that exits the reason why they're exiting, and hopefully they put that in their resignation letters for us, or we offer to meet with them to understand why they're leaving. But those are some of the reasons. Or commute. Sometimes they want to be closer to home. So there's a lot of different reasons that we see. And then you had also asked about, we have seen, because I think of the turnover we've seen a lot of new hires coming in, and that's why I think we have the low tenure that we have. That's such a high number for that amount. Whenever you have turnover, you're going to then have a lot. I'm sorry, I'm getting distracted a little bit. I'm hearing a noise. But you do end up seeing then that you're going to have a younger workforce with that as well. So.
Supervisor Achterhoff.
Supervisor Long asked the same question I was going to, so I don't have it.
And we can provide reports on the reasons as long as we take out anything personal that would be an identifier. We do track, like I said, the reason people exit. So I have that information. I'd have to, I can just scrub it a little bit, make sure there's nothing that shouldn't be in there.
Any other questions, comments? Thank you, Tara.
Okay, you bet.
Next item then is a request for future agenda items. None. We'll go on to county clerk's report and correspondence and rezoning requests. None. Announcements. Supervisor Fiedler.
Mr. Chairman, just a feel-good announcement. Supervisor Long and Osnes and I are all on the Economic Development Corporation Board as your representatives, and we had our awards banquet last week, and I'm just very proud to announce that the Director's Award, which is the highest award, and it's for lifetime of service to the county, went to our former administrator, Pat Thompson.
Thank you, Bob. Also, just a note on my, I just heard this afternoon that our court, what's Mike's position? CJCC coordinator, Mike O'Keefe, has decided to retire from his job. We'll lose him, I think, in May, I think he said. So I just want to acknowledge the time I've had to work with him. I wish to publicly thank him for his service, and would encourage all the supervisors too when you see him also. Other than that, any other announcements at all? Seeing none, I'll adjourn this meeting at 7:12. Thank you all.